I'm one of those lawyer lobbyist types where I really started out as a civil rights attorney that then moved into advocate, that then went to work in a hospital, where all things that happen to kids have inspired me to really focus in on solving for our current youth mental health crisis. So essentially for, I'll say the last 2 years, I've been in almost daily meetings, really trying to figure out how to support kids with complex or high needs in youth mental health care. So picture yourself a parent and you're responding to your kid in some kind of mental health crisis. You're not sure where to turn, so you come to an emergency department because that's where you know to go at this point. You wait, your child is escorted back, often without you, to an emergency department room, and what you're told is, I'm sorry, but your child's gonna have to wait until a bed becomes available. Days, weeks, months on end, stuck in a windowless emergency department room and being met with a total lack of urgency from the systems that are meant to serve them.
I've been a social worker in the emergency department for the last 7 years. I think we all come to expect that when there is a medical need, whether that is with physical health or mental health, that an individual can get care immediately. Over the last 2 to 3 years, we've really seen a surge in mental health patients coming to the emergency room in crisis, looking for guidance.
So talk to me about how many kids on average you're seeing in the psych ED every single day.
On any typical day, we can have 30 plus patients coming in the emergency room. I'm personally seeing longer wait times in the lobby, even to get a room, because of the backlog of patients that we have in current rooms, and then once they're evaluated, waiting for a bed placement.
Cecilia is 9. She has kind of dual personalities. Her core is she's fun-loving and happy and sweet and really caring, sensitive. And then this other side, which has to do with her disability, is just totally opposite. She can be very violent and aggressive. We have a lot of fun together, but then if she's dysregulated and having a really bad day, the day would look like me just worrying, is she going to take off? Is she going to run away? Is she going to get in an altercation with someone? Am I going to have to call the police? Cecilia was just having what I call like one of her episodes where she was just really aggressive for no reason, being violent with me. I've never seen her so angry. The ambulance had come and they were trying to help her. Cecilia was just crying, saying she didn't want to go anywhere. She was sorry. I didn't know what else I could do for her. I decided to let her be taken to the emergency department because I was terrified. The only hope that I had was that she could be hospitalized somewhere for a short period of time to stabilize her.
I am a psychologist at Cincinnati Children's Hospital. A lot of the work that I do is focused on helping to support kids with the most complex needs who are trying to find and access the right level of care in the system. And so in our day-to-day experience, what we're starting to see are longer and longer wait times for kids kind of at all different levels of need. The emergency room is great at a lot of different things, but it is not designed to be a very therapeutic environment for kids who are in mental health crises.
When we got to the emergency department, Cecilia was in kind of a holding period, and a provider would do a mental health evaluation. Based on that assessment, they would recommend hospitalization or discharge or make a plan. The recommendation has been hospitalization every single time, but they can never find a bed for her is the problem. On that specific visit, no beds were available. They decided to hold her another night, then they would check again the next day for beds, and that pattern would repeat for days. We were in the same room that we checked into, which is a room with nothing in it. I think it would make me go a little crazy if I was in a room like that with nothing to do. The longest time Cecilia's had to be in the emergency department was 8 days. She was 8 years old.
I don't think most people have any idea what these rooms look like.
Thanks, Kevin.
Yep.
What you're going to see here first is the main place where our patients will come, and this is the space where they will live. And as you can see, it's a safe space, but it's very stark.
It is meant to be short term, and I mean short term, hours at most. It is not a place you want to live.
When you have a patient who's in this room for hours, days, weeks, months on end, there needs to be a safe place for these patients to be able to come and allow for change of scenery. But as you can see, this isn't a place that you're excited to come into. This isn't a place you want to spend a lot of time in.
I'm the president and CEO of Connecticut Children's Medical Center. It's based in Hartford, but it has services that extend through New York and Massachusetts. When I first arrived, we had to renovate space in the emergency department to accommodate a growing number of children. This was 8 years ago. Zone C is a unit. There are 12 rooms. They have doors, but they don't lock. And Zone C gets filled, they're out in the hallway outside of Zone C with people guarding them. And it can be a week at a time. We now have 2 or 3 security officers, 7/24, in the ED to try and protect the kids from themselves, protect the kids from other children, and to protect the staff. And it's starting to look like a prison. And we're not doing the right thing for children, and we're not doing the right thing for their families.
That was probably time number 20 that we had been to an emergency department. I was told by the evaluators at the hospital that she could potentially be sitting in the emergency room for a month. They had given me examples where they had seen other children who had sat in the emergency room for up to 90 days waiting for a bed. When I heard it could be 90 days in the hospital, I just thought that just can't be. I knew that if I brought her home, situation would be no better, and it's only a matter of time before something else happens next.
My name is Ronlee Liao. I'm the mental health and chief at Children's Hospital Colorado. We call it in the mental health field the boarding crisis. All of my colleagues are seeing exactly the same crisis. Lots and lots of kids boarding, way more than we've ever seen in our whole careers, and no end in sight. What they need, we don't have available in our system. And there's either a long wait to get it, or there's a wait till there's no other solution, right? There's a wait to nowhere.
My career has been dedicated to taking care of children in urgent and emergent situations. Think about the parent. Think about the parent. We have to tell this parent and parents like her every week, we would like to help with placement for your child, but out of the 4 or 5 facilities in our state. Well, only one of them will take children on the autism spectrum, and their wait list is 8 months. And so, sorry, we can't help you.
There should be more options available, and that's the problem, that there are not very many options. Cecilia, when she comes home after being in the emergency department, it's almost like her condition is worsened because it is very traumatic for her. I feel like her mental health is declining, and she becomes very depressed and sad and has cried a lot. And sometimes she's even said to me, I'll be a good girl if you bring me home. She thinks it's a punishment.
These experiences that are happening during childhood or adolescence, they will undoubtedly have an imprint. It's like that fingerprint. And it's not just for the rest of their life, but it is actually for future generations as well.
Children feel differently about what they can rely on from their parents when they're not able to leave a hospital room. And unfortunately, parents are the ones that get blamed for something that's completely outside of their control.
Every family that comes in has a sense of guilt. What did I do wrong? Is there something that I should have done during the prenatal period or when they were younger? There's nothing you did wrong.
Sometimes, I find myself looking at other parents and families. I just need a second. I'm sorry. I find myself wondering often, what is that like to send your child to school and not worry all day when the phone rings, where you're having a panic attack because the phone rings and you think maybe my child has had to go off in an ambulance? What is that like? Because I don't know.
It can be frustrating to know that there are potentially system fixes and ways that potentially we could solve some of the administrative and information sharing barriers that prevent us from being able to serve kids in a better way. I think sometimes it can feel like we are watching preventable tragedy happening and not doing anything about it.
So it's a pretty big statement that you agreed to be part of this project. Why are you doing this? Why are you here?
Everybody knows about the mental health crisis in this country, especially coming out of the pandemic.
I saw a study the other day that 1 in 5 children need some type of behavioral health service.
When you get to children, if you get to them early and you give them the care they need, about 80% or 85% of them aren't going to have any problems later. But it's just like an infection. If you don't treat it early, it's only going to get worse, and it'll be more difficult to deal with.
Why have you taken on this crusade?
You can't not act in the face of that level of suffering. And when you're given the opportunity to bring a voice to that can impact change and have it be different, you can't sit by and just let things happen. We're changing these kids' lives for the worse forever.
I was born and raised in Costa Rica to a Cuban father and a Costa Rican mom. My dad worked really hard and he became very wealthy. When I was 11, moved here. While I did have a very privileged and fortunate life, my father did suffer with alcoholism, and a lot of his experiences impacted my family. I was never given the tools at a young age to understand how my mental health was being impacted by my environment. When I was 14, 15, My father was living in Costa Rica. My dad got taken advantage of by a coworker, and we lost every cent to our name. Him and our family in Colorado, we were not in a great place, so he didn't see a reason to try to fix it. So he committed suicide when I was 15. My life changed overnight. I had to get a job and work 50 hours a week as a freshman in high school to pay the bills. The only thing I saw that could help me was partying with my friends. And that got me in quite a bit of trouble with my mom. My mental health just plummeted from there. And so that's where I started experiencing self-harm, suicidal ideation. It was a weird night. I was trying to run away from the police and they found me. And I told them I was gonna kill myself. And they handcuffed me in the police car and took me to the emergency department. And this was the first time that I'd been to an actual hospital rather than a short-term placement. I was very nervous. I knew that this was different. They placed me in this room that felt like a jail cell. I was so afraid and it felt so violating.
I'm a child psychiatrist. I oversee all of our emergency rooms across our 5 hospital setting, as well as the urgent care settings and our inpatient consult services. An emergency room is set up to provide diagnosis. It's set up to stabilize and then pass along, either admit to a level of care or to discharge home. All these kiddos, when they're not in the right environments, they're being triggered. If they're in an environment where people don't understand that and they keep triggering them, that's not setting the kiddo up for success.
It is crushing to stand in these rooms with these children day after day, have these kids ask, when do I get to leave? I want to go home. I want to be able to leave. Stuck in a windowless room without anything and not be able to respond. And to just have to do the best that you can do when you know that is not the best care.
I'm not a person who feels angst or frustration, but I got so angsty that I started banging my head against the wall, like literally banging my head against the wall for something to happen, for someone to come check on me, for someone to say something, for me to pass out, for all I cared. It got to the point where I was scratching my skin raw, like I was stripped of everything. I didn't know who I was. I felt that my grief was a crime, that my grief was wrong.
Why do you think you want to go? So hard. Come on.
We have come to learn over the past few years, our training has really been woefully inadequate to deal with the kinds of issues that we're seeing our kids struggle with. And so you have these families and these kids who come to the emergency department often as a last resort. Sometimes they're told that's where they should go. Go to the big children's hospital. That's where all the specialists are. That's where all the resources are. The truth is, even the biggest and best children's hospitals aren't equipped to deal with the swath of issues that we see.
My job in the emergency department is to find places for kids to go. If it's a child who just needs a psychiatric bed, I find that. But then there are other kids, and I try for several days sometimes to find those beds, and those children are not accepted by other facilities. Sometimes it's just due to we don't have any beds in the whole state. Sometimes it's because of that child's individual acuity, so that they can't be in a population with other children and be safe.
All right. Sure. Thank you. Bye-bye.
What we're seeing more and more is hospitals won't accept a kiddo because they don't want that kid clogging their system.
A lot of times there are funding barriers, especially when we're talking about trying to get kids into residential placement centers, and the process to secure that funding in order to be able to get those kids to get access to that level of care can take weeks, months, sometimes it never comes. Oftentimes for these kids, we can be applying to 10, 20, 30, 40, 80, 100 different places. The process is just so wasteful and so confusing and so inefficient that there is so much to be done to just streamline even the application process.
Are you kidding me?
We had been, on a daily basis, calling every hospital in the state, asking, can we send a child to your hospital? And they kept saying, no, we're full also. We've never seen this kind of a surge of patients for this long period of time without some form of resolution. We can add more and more staff and resources. It's just not keeping up with the demand. And I've never seen that disparity before.
I always tell families, if I could send you to this placement right now, we would have done it 20 minutes ago. If I had any power to navigate the systems that are barriered in our current stance, I would get you there yesterday. It's hard to not put yourself in the shoes of that mother, that father, that kiddo, and not appreciate. No one really wants you here, right? I understand bureaucracy. I understand politics. But what you can't really put your finger on is when you see like that family come in. Yeah. And probably the providers, because I have to be the voice to say back to the family, sorry, we suck. We can't do more, in a very frank way. But it's hard to hold the emotion, for sure. You know, and it's just sad, because like the reasons I went into what I do, watching kids get marginalized, the stigma of mental health, this isn't fixing that. We're contributing to it.
Everybody is struggling. Every colleague that I speak with at a children's hospital, in a community mental health clinic, in private practice, everyone is saying the same thing, that they're seeing more children and adolescents than they've ever seen before. They're seeing more stress on families and our communities, and they're seeing cases with greater complexity.
My name is Mark Arnazza. I am Senior Director of Patient Care Services at Children's Hospital New Orleans, Louisiana. Imagine working in an emergency room. You're dealing with 15 to 20 children that are coming in for a behavioral health complaint. Some are in severe dysregulation, some are very suicidal, some are homicidal, and navigating that with everything that is portrayed and to you and being able to take care and understand and process that trauma is challenging. You're seeing emergency room nurses who might not necessarily have been wanting to go into behavioral health as a career, but then 60% of their patients are with a behavioral health complaint. It takes a toll on us. You know, there is this thing called vicarious trauma, and it is impacting the workforce tremendously.
There are high rates of burnout and there are high rates of turnover. And so it's really hard to make change because there's constantly a new workforce as well as an overwhelmed workforce.
Each day to come to work and see children who are just really struggling, who are really depressed and anxious and really hopeless is really disheartening.
It's having pretty profound effects on our culture. You know, when we bring in new staff, they're excited. It's a new role. They're coming into this, you know, Children's Hospital top 10 in the country. They're part of an amazing team, and you just see that wear down so quickly.
You do your job perfectly, and the handoff isn't there. And you're watching the child that you have just helped begin to decompensate because the care that you know they need to have isn't available.
I was there for 2 weeks before I was put in a residential treatment center for 4 months. I got out of residential when I was 16. Nothing changed in reality. I still hadn't developed healthy coping mechanisms. A few weeks after my 19th birthday, I got diagnosed with cancer. Stage 3 angiosarcoma of the breast. And that's where everything hit me. All of this, just manifested so strongly. And the tumor was right next to my heart too, which is to me, such an interesting symbology of the weight that I was carrying that was killing me. I had to go through chemo. I lost my breasts. I went through menopause. How much worse can it get? And that's what kind of shocked me back to life of wow, I need to do something about this in a different way. I'm in weekly therapy now. I'm a nanny. I've been a nanny for this girl for 1.5 years, and she's been a great teacher to me. Just my life that I've created for myself. I did all on my own. When my physical health was breaking down, the support I received was unlike anything I've ever experienced. The community that showed up for me, the people that came into my life, the support I got from the healthcare system, I received all of that, and it was amazing and beautiful. And when I went through cancer, I got diagnosed, and the very next day, I could have started treatment. It was so fast that they were there to catch me immediately. Whereas with my mental health, I was in that ED for 2 weeks with nowhere to go. They didn't know what to do with me. At the end of the day, I was a grieving child, and my mom was a grieving woman. So the things that we had gone through just separated us so much rather than brought us together, because we never had the tools anyway to begin with to understand what grief is. If I had been offered help as a young kid, if help was offered to my mom at that time, it would have been completely different.
I've seen children of kids I treated in residential. I've seen their children in the emergency room because we weren't giving adequate care to that person who is now a mom when they were a child. If we don't help this generation, what are we going to do with their kids? Because that's coming. If we can't meet our needs now, what's it going to be like in 15, 20 years?
When you've got a situation like that, state leaders aren't doing their job if they're not stepping up and partnering and trying to find ways to address this. What I would recommend in places where you're not getting a decent response, quite honestly, I'd go public.
The number of kids hospitalized for mental health issues has been on the rise here in Central Florida.
Pediatricians across the country are sounding the alarm about children's mental health. Here in San Diego,
national organizations are declaring a state of emergency in children's mental health.
School administrators have been sounding alarms about a growing mental health crisis among
Mental health
students.
emergencies went up 24% for children ages 5 to 11 and 31% for children ages 12 to 17.
The first time I became aware of this notion of kids being stranded in an emergency department happened 4 years ago. We've been talking about this. We've been trying to get this on the radar of people who can make a difference for what feels like a long time. That's usually the situation. Yeah. So then the hospital's stuck. When we first went to the state to say, we've got a real problem here, we were told, Once a kid has been in an emergency department, after 72 hours, you can submit a form to the state and let us know that you have a kid stuck, and then we'll try to help. We still have kids living in the emergency department for weeks and months on end. I think where the anger comes from is for those in places of power. There is complete awareness of what's happening. There are regular calls, there are regular meetings, and the response to these meetings is, let's bring more people to these meetings and keep talking about it. And let's keep asking for more data, and we'll keep talking about it. I cannot answer why there isn't a greater sense of urgency. All I can say to that is people are not getting it. As a country, we have not done anything that we have needed to create a system of youth mental health care.
When I go down to the ED, there's a pool of people who surround me. What are you doing about this? And we say we're talking to the state, to the governor, to legislators. That doesn't take care of the problem at that exact time and place. And so it's very frustrating.
Ultimately, when we come to a patient that doesn't have a solution, we're left with just having conversations about solutions. And I think that's what's most frustrating as a healthcare provider. We just tend to stumble into barrier after barrier after barrier. And if we just keep doing the things the way we're doing them, I don't know how it's going to get better.
It feels like there's a Groundhog's Day phenomenon where you're saying the same thing, you're going around in circles. There's this learned sense of hopelessness right now throughout the system, and we need to do something to change that.
I think we all play a part in this. It comes down to politics. It comes down to voting. And we've lost how many thousands of beds, over the past several years. We're going the wrong direction, and we're doing this the wrong way. We need lawmakers who will find the money to do something about this and find the resources. And so we need to vote those lawmakers into office. This isn't a Children's Hospital Colorado problem. This is a United States of America problem.
I think the state is going to have to provide some leadership and funding for a continuum of care. You have to have the state leadership acknowledge there's a problem before we can start solving it. And in some states, that's a challenge.
From a mental health perspective, I promise you, we all feel like we're in the middle of a war right now. We're bleeding out here, and we've got solutions that are 2, 3, 5 years down the road, and still not the right people working with the right people.
A 100% there are solutions to what we're dealing with. We don't have to be in this place. I think the people who can most effectively address this problem right now are our state's governors. Governors are uniquely positioned because they have the ability to quickly tap into the kinds of resources that are going to be needed to solve this problem. They also have the unique audience of federal lawmakers and the President of the United States in helping to solve this problem.
One fun thing about being governor is that you can do a lot of things and accomplish a lot of things and actually see the results of your work. But this is an area where seeing the results of your work is going to be 15, 20 years down the road. And your elected politicians tend to shy away some from those kinds of issues and getting involved in that because they can't bring it to a conclusion. I can't declare victory, and show that we've been successful.
If you think about people living in an emergency room, people don't want to be in an emergency room for an hour. And yet we're talking about our kids who are stuck in there. No community should sit back and let these kids go unattended, but it's going to take work. Leadership means that you have a moment in time when you can do something to improve the lives of people. If you do not take advantage of it, you will look back and you'll rue the day that you did not take care of the people who you could have taken care of.
Mental health care is too darn important to play games with. And it's not a political issue, and it shouldn't be a political issue.
My name is Jennifer Labb. I work at the National Health Law Program. We advocate for access to health care for low-income and underserved individuals. As a child, I had a lot of struggles, and I was labeled as serious emotional disturbed. There was a recommendation at one point for residential treatment. I didn't end up going, but I was asked not to come to school for some time when I was 10 years old. I remember what it felt like, and it makes me want to create a world where every child feels welcome in their home, in their community, and their schools, where they not only have a right to be there, but they're going to be supported in the way that they need, and they're going to be wanted. Best systems are the ones where the state has really bought in. They share the same goals, right? And they're not hard goals to get behind, right? It's that children thrive in families and that we want children in their homes and communities and we want to support them. In terms of children, there's a benefit that has existed since the early days of Medicaid called Early and Periodic Screening, Diagnostic and Treatment Services, which is a mouthful, EPSDT, the program that covers children in Medicaid. Private health insurance can simply say, we have a limit on services, or we don't provide this kind of service. But with EPSDT, if you have a medical professional that says this is medically necessary and it's something that Medicaid can cover, then it has to cover it.
EPSDT is 100% a mandate. It's a requirement under the Social Security Act. Already exists, not a debatable point, must comply. Most states are not meeting their requirements under EPSDT. It is a very comprehensive program. And what it requires from states is a constant commitment and vigilance and resources. And most states are not coming forward in the way that they need to ensure that those requirements are being met. If states don't comply with this law, they can face litigation. In fact, there are a number of states that have been sued and lost as a result of failing to meet this obligation. We are seeing that many more kids winding up in higher levels of care because states have failed to provide the appropriate levels of services on the lower end of the spectrum. The whole point of EPSDT was to say you catch kids early on with their needs, and it's a lot less expensive. You actually save money. The goal is not to have more kids in crisis wind up in the ED. It's to have those needs met way further upstream so that they never end up in crisis in the first place.
I think probably Cecilia would want you to know how much of her youth has been taken away by all of this. Just countless hours sitting in the emergency room or going to different treatment facilities that never really even assessed her properly. If we had been in the emergency department at least 20 times before we got a caseworker, and the only reason we got one is due to an advocate bringing that up. I didn't even know it was a possibility. I'm really not sure what the case manager is supposed to do because I've reached out to her and, she, I think one time tried to help me find a psychiatrist for my daughter, which is great, but I can do that with Google. I feel like if they are not able to place her and they do discharge her, there should be more in-home support.
I think in an ideal world, you're really only using the emergency room when all of the community options have been exhausted.
We don't need a bigger physical space to see more mental health patients. We need fewer mental health patients in our space. And so they need a place to go to get the resources they need.
I think it goes back to what do you do before you get to the emergency room? And that's being in the schools, being in the community. How do we help get families resources and education before they need it?
I think that we need to have a functioning community behavioral health system that includes supporting families in the home. We need to have what are called high fidelity wraparound services where everybody who's involved with that youth, whether it be the school, their church, their coach, their behavioral health providers, their primary care providers, they're all working together on how best to meet that youth and family needs.
I am director of the Institute for Innovation and Implementation. The Institute's job is to help improve outcomes for children who are involved in public sector systems. That home and community-based intervention model for children where we don't bring them to the hospital, we don't even let them show up there, is really one of the things all states are working on right now, struggling through, and should be an approach that, you know, really kind of turns the tide on these ED overstays.
There is a lot of federal money on the table for states to provide the service. They can draw down federal dollars for it. And there's actually incentives right now to provide some of these services.
There's money that's coming out to states to really redesign crisis services. The states who have been early adopters of progressive measures like mobile response and stabilization, where teams go to people's homes, are doing better. There are less ED stays, there are less kids languishing in emergency departments. I tell people all the time, this is gonna look ugly for a bit, right? It already looks ugly. It can't stop us from moving. We need to move now and then innovate along the way.
It's not an area that you're going to make money. It's going to be hard to recruit and retain staff, but that doesn't mean we shouldn't do it. It's one of the biggest needs in our nation right now, and in my opinion, we all have to do it, and we need to stand together. Our kids need us.
We need to invest in our people by investing in the health of our people, which includes mental health. So let's get on with it.
Inaction feels like indifference. How can you know what's happening and not move quickly to have it look different?
We're actually at her therapist's office here.
That's a super.
These are state and federal government officials who have the incredible opportunity to do something now. There's no reason to wait. There is the opportunity to act and respond now.
Isolated, watching time go by, trying to find a way out. Complicated, inside my mind, so many things that I've been through. Isolated, watching time go by, trying to find a way out. Complicated, inside my mind, so many things that I've been through. Patiently pacing, waiting in vain. Lost my drive and got tired of the pain. Walls closing in, my calls are not answered. Wonder if anyone could hear me to take action. Bringing lasting change and true balance. Instead of spinning in circles with no guidance. For too long I survived, sleep deprived, but held on to my purpose and focus is shining bright. Be a satellite of inspiration. Come together, find treatment and solution. Better tomorrow. Tightrope, straight and narrow, seeking treasures in the shadow. Take flight like a sparrow on our way up. On our way up. I'm trying to stay up. It gets hard sometimes. Isolated, watching time go by, trying to find a way out. Complicated, inside my mind, so many things that I've been through. Isolated, watching time go by, trying to find a way out. Complicated, inside my mind, so many things that I've been through.
People ask how I'm doing, I got no answer. Dance
dancing around the truth, and I'm running on fumes, man, like I got no juice to do the things I love to do. I've stared into the jaws of the dragon, carrying this weight in my heart around. I forgot who I was, or maybe who I am. I just can't seem to figure it out. I need a lighthouse, somebody who could guide me, somebody who could find me and pull me up when I'm sinking. Can't breathe and the dark keeps rising up. I search for the sun some nights, put stars in my pockets just to keep light close. I need help, I'm all by myself, and I just need a hand to hold, and that's real.
Isolated, watching time go by, trying to find a way out. Complicated, inside my mind, so many things that I've been through. Isolated, watching time go by, trying to find a way out. Complicated, inside my mind, so many things that I've been through.